Good morning, everyone, and welcome to the Denver Museum of Nature and Science at Home webinar series on COVID-19. I'm Kristen Uhlenbrock, and I work at the Institute for Science and Policy, a project here at the Denver Museum of Nature and Science. We've been hosting this series with our great partners from the Colorado School of Public Health. A huge thank you to them, in particular, John Samet. He's been very gracious, diligent, thoughtful, and has committed a huge amount of time to helping us put this series together. So thank you, Dean Samet, for everything you're doing to put this together. We know you've been working tirelessly behind the scenes here for our state as well. Of course, a huge thank you to all of my museum colleagues who help us put this together. It really does take a team, and I'm so thankful to each and every one of them. A little housekeeping before we get started. We've got two audiences joining us here on our webinar this morning. Thank you to those of us who've tuned into Zoom. It's great to see many returning guests and faces. And hello over there to our Facebook Live audience as well. We really encourage you to provide thoughtful questions into today's episode, as we do with everyone. So if you're here on Zoom, open up that chat feature that Alyssa's been telling you to say hello on. Feel free to go ahead and say hello and type in where you're tuning in from. That's where you're going to be asking us our questions, so go ahead and type them in. We see all of them as they come in. If you're over on Facebook Live, you can type in any of your questions and comments into the comment feature. We've got our eyes on that as well. We incorporate the two, and when I look at them and I try to incorporate as many as I possibly can, of course, with the small caveat that we typically do not get to every question, but we really enjoy your thoughtful ones. So please stay engaged with us throughout today's episode, which will be for about a full hour. If you've missed any of our past recordings or episodes, you can find both written recaps and video recordings on the Institute website. Just go to institute.dmns.org for all that information. We have a nice landing page right there. So today is the second in a two-part series where we've been talking about race, inequality, and COVID-19. And to be honest, speaking with both last week's speakers and today's speakers, we could very well be calling this racism, inequities, and COVID-19. There is slight nuance in those words. But last week we heard a little bit about some of the historical and systemic inequities that have influenced our healthcare system long before COVID-19 had ever arrived, and how that's impacted different racial and ethnic groups. So today we're going to be building on that conversation with three distinguished guests. They bring a wealth of experience thinking about and dismantling racism and leading grassroots initiatives to help empower people and communities faced with these unequal and disproportionate impacts. So I'm very honored to have all three of our guests today. Give you a little bit of background about all three of them before we start passing this over. Our first guest is going to be Mike Cortez. He is a scholar in residence and special community member at the DU Graduate School of Social Work, where he previously served on the faculty and taught graduate courses in public policy analysis and social policy advocacy. He is also the executive director of the Colorado Latino Leadership Advocacy and Research Organization, which is a nonprofit established in 1964 in Denver to help Latinos in Colorado. Mike also chairs the Denver Commission on Aging. He's held faculty and administrative appointments at the University of Colorado, Denver, the University of San Francisco, University of Colorado, Berkeley. He began his career in 1971 as a community organizer and then later returned to school where he earned his master's in public policy and PhD degrees in public policy at the University of Colorado, Berkeley. He's worked for a variety of research advocacy and public policy organizations, including the National Council of La Raza, now called Unidos US in Washington, DC. And he's had an extensive list of service activities, including serving on the boards of the AARP National Policy Council, the Center for Lobbying and Public Interest, and many other positions. We're very excited to have Mike here with us today. Our other guest, our second guest, I should say, is Alicia Brown. She is the current Senior Vice President of the Foundation for Sustainable Urban Communities and the founder and director of its Be Well Health and Wellness Initiative. Her focus is to advance equity through community-based strategies to ensure that all people have the opportunity to live healthy and prosperous lives, regardless of their social circumstances. Ms. Brown was raised and has raised and or leveraged more than $50 million to advance equity and anti-racist policies, systems, and practices across Colorado. Her work with the state of Colorado, city and county of Denver, and the city of Aurora have led to COVID-19 community testing sites in underserved areas of our state. She has earned her master's degree in nonprofit management from Regis University while being a Colorado Trust Fellow, and has an undergraduate degree in broadcast journalism from Langston University, which I found fascinating. She's a leader in so many ways, as well as serving on various boards and commissions, including the State of Colorado's Health Equity Commission and the City and County of Denver's Board of Public Health and Environment as the chair. She's an active member in the Rising Star Missionary Baptist Church and serves on their liturgical dance ministry and is a writer for the Christian School newsletter. Our third but not final guest is Dr. Jennifer Ho. She is the daughter of a refugee father from China and an immigrant mother from Jamaica. Dr. Ho is professor in the Department of Ethnic Studies and the director for the Center for Humanities and the Arts at the University of Colorado Boulder. She received her PhD degree in English from Boston University and then served on faculty at the University of North Carolina at Chapel Hill for about 15 years, just previously before coming to Colorado. There she taught courses in Asian American literature, contemporary multi-ethnic American literature, critical race studies, and intersectionality. Dr. Ho is the author of 3 books, including the book Racial Ambiguity in Asian American Culture, which won the 2016 South Atlantic Modern Languages Association Award for Best Monograph, among an array of other publications. And she has a couple of books currently in the works as well, too. She is the current president of the Association for Asian American Studies and is active in community engagement around issues of race and intersectionality. She leads workshops on anti-racism and how to talk about race in our current political climate. So as you can tell, our 3 guests are very well experienced and distinguished in their own rights in their careers and can provide us some really great perspectives today. Before we do get started, we came up with a couple of poll questions that we wanted to engage our audience in. So if you're here on Zoom, we're going to go ahead and put up that first poll question. Alicia, if you can cue that for us, thank you. So question 1, is racism a public health concern? And your 3 choices are yes, no, or unsure. We'll give y'all just a couple minutes. I should say seconds, not minutes. Okay. Overwhelmingly, 94% of our audience does think that racism is a public health concern. Great, thank you. We've got another poll we're going to ask, and these polls are meant to influence and shape some of our conversations later today and get a sense of our audience. So I'm not going to talk about them right now, but they will come up eventually down the road. So our second question, I consider myself racist, not a racist, or anti-racist. Anti-racist seem to have the majority of people select that one at 67%, not a racist at 27%, and racist at 6%. Thank you very much. Okay, so enough of me talking and welcoming our guest. I want to give them the floor to speak. Each of our guests are going to provide a little bit of some opening remarks, and then we're going to go right into some Q&A. But up first, we're going to have Mike Cortez join us. Good morning, Mike. Could you tell us a little bit about the work that you're doing, as well as how the Latino and Hispanic experience in Denver has been shaped by or is currently being impacted by COVID-19 in our area?
Good morning, Kristen, and good morning, everybody. It's my privilege to serve as executive director of the Colorado Latino Leadership Advocacy and Research Organization. We are an organization founded back in the very early days of what some of us old timers call the Chicano Power Movement. We're very much about helping Latinos in low wealth, low income communities in Colorado work together to solve problems of their own choosing. We're very interested in education, we're very interested in health, we're very interested in civic engagement. And so a lot of what I have to say today is driven by that vision of our organization. This morning I've got some facts and opinions that I'd like to share with you. Some of them might surprise you, and maybe you'll think some of what I say is wrong. If what I'm about to say is wrong, I've got a challenge for you. Just for fun, try thinking like a scientist. Make a note to yourself of something that I said that seems wrong. And after we finish this morning, do some research. Look for scientific or scholarly evidence that contradicts what I said. If you can't find it, don't give up. Ask a reference librarian to help you run it down. I don't recommend relying on opposition research based on motivated reasoning. By motivated reasoning, I mean something that looks like logical research, but it only cites evidence that supports the writer's preconceived ideas. That's not real science or scholarship. I suggest you look instead for blind, peer-reviewed publications and reports relying on scientific logic. Some of the most helpful ones use unbiased measurements or observations that test competing hypotheses. And then send me an email, complete with bibliographic citation of evidence-based research that suggests I'm wrong, so I can check it out. If I say something today that's not true, I want to know. Okay, so here's some facts and opinions I want to share with you. I'm going to start with the facts. COVID-19 hurts Latinos more than others. I'm going to share my screen here a bit. Latinos in the United States are a little under 19% of the nation's population, but we make up 35% of all our COVID-19 cases. And another slide I want to quickly show you. We think of this as a disease that puts older folks, most like me, most at risk. But I want to focus a bit on children between the ages of 5 and 17 who have confirmed cases of COVID. More than half of them are Latinos. And if you look at youth and young adults who have confirmed cases of COVID-19, 43% of them are Latino. And a lot of them die. You look at children and youth who die from COVID-19, 40% of them are Latino. So back to my program here. Why is this happening? I don't think the virus prefers Latinos. So what do the facts suggest? Latinos or Latinx people or Latino Americanos are not a race. I want to just go some basic facts about Latinos first. Rather, Latinos are a diverse, multiracial, multinational ethnic group. Many Latinos in the country are immigrants, of course, but most Latinos in Colorado are not. Latinos have lived in what is now Colorado since before the arrival of English speakers. The Arkansas River that runs through Pueblo, Colorado, used to be the border between Mexico and the United States, years before Colorado became a state. All land in Colorado south of that river used to be part of Mexico. The land down there includes the town of San Luis, the oldest town in our state. Spanish has always been and still is the first language spoken by many of the families who've lived in San Luis for generations. English speakers are relatively recent arrivals in our part of the world. Some Latino families in Colorado have lived in what is now the southwestern United States since the 1500s, before the Pilgrims landed at Plymouth Rock. 10 years ago, 1 out of 5 Coloradans were Latino, and we've been growing. 5 years from today, 1 out of 4 Coloradans will be Latino. So why is COVID-19 giving Latinos such a hard time? The answer seems to be economics. Since the 1950s, economists who study US labor markets have gathered ample evidence of what they call labor market segmentation. Throughout history, since colonial times, the kinds of work that people do in the United States has been influenced in part by their race, national origin, ethnicity, and the language they speak. Those same factors have also affected people's educational opportunities, their earnings, where they can buy and rent places to live, the way they're treated by government and police and their fellow citizens, and even whether they can serve on juries or vote. Labor market segmentation affects Latinos in several ways. Today, Latinos are concentrated in jobs that have the highest risk of exposure to COVID-19. Latinos are more likely to be classified by employers and government as essential workers and are less able to work at home while others are safely quarantined or sheltering in place. Latinos employers are less likely to provide health insurance. Latino children are less likely to have access to broadband internet, so during the pandemic, it's harder for them to keep up with school lessons at home. So those are the facts, and I'd like to close with some opinions. The COVID-19 pandemic is hitting Latinos harder because too many of the people in our country who decide who gets hired for which jobs and how much they'll be paid and whether they'll receive health insurance and whether their children will attend good schools and whether people who lost their jobs and are behind in their rent should be evicted. Too many of those decision makers are people who tend to treat Latinos and other minorities differently from the way they treat non-Hispanic whites. Does that sound like racism to you? If you think I'm wrong about the facts I'm sharing with you this morning, I look forward to hearing from you. I promise to take a good look at your evidence. Thanks for being part of the discussion this morning, and I hope you ask lots of questions. Thanks, Kristen.
Thank you, Mike. Very poignant. Okay, let's introduce our next guest. Good morning, Alicia. Welcome and thank you for joining us here. So you founded the Be Well Health and Wellness Initiative. I'm wondering if you could tell us a little bit about what that initiative is and some of the ways you've been engaging with communities since COVID-19. Alicia, we got to take you off mute to hear you.
I apologize, I'm now off mute. Thank you, everyone. I'm glad to be a part of this panelist. Thank you to my fellow panelists. I look forward to interacting with you, and thank you, Kristen, and the Institute, as well as the School of Public Health. I am Alicia Brown, and I head our Be Well Health and Wellness Initiative. It is an initiative of the Foundation for Sustainable Urban Communities. It's an initiative that was really founded and guided by residents long ago, back in 2003, who really saw a challenge with equity and health way back then and saw disparities in primarily communities of color that were not showing up in other communities. And we started way back then in thinking about, why is this happening? What are ways in which we can address these challenges? And is it that we don't have, it isn't that we don't have the same common goal, but why is it that African Americans and Latinos are, and our Asian Pacific Islanders community, why are we disproportionately impacted by the disparities that exist in our communities? And so we really focused on 6 areas in Northeast Denver and Northwest Aurora to really think about what that means and why. And over this period of time, we've really worked to see what programs, policies, research, etc. has been done, and then how that impacts the day-to-day lives as far as economics, housing, transportation, and other social determinants of health. And so in working in all of these key areas, we've really found that, similar to what my fellow panelists has said, is that there are challenges in the leadership and the opportunities for these populations to be able to advance both in day-to-day society, but also in health. And we will go through some of those challenges as we continue this conversation. But one of the things that we want to definitely bring up is that in thinking about the social determinants of health, which we really focus on through the Be Well Health and Wellness Initiative, we find that the decision making for those social determinants, or the things that impact those social determinants, are really influenced by people that are not the most impacted or not the most vulnerable. And our goal with the Be Well Health and Wellness Initiative is to provide opportunities that allow those who are most impacted to engage in the decision-making processes that are impacting their communities the most, and to also begin to serve in some of those leadership roles. Because until we see a reflection of those serving our communities in leadership positions, as well as in decision-making opportunities, and I'm not just talking about having someone be the next city council person, but at every level of leadership and at every level of being able to make decisions, engaging residents in those decision-making processes is important for us, and that's a lot of what we focus on. Additionally, in Be Well, we try to look at what programs, policies, procedures, and practices are literally impacting the day-to-day lives of our residents, and to try to gain some influence in how and what that means to everyday life within the communities that we serve. We, again, work in 6 different neighborhoods. They stretch from they stretch over about 150,000 residents in Northeast Denver and Northwest Aurora, and we work with various different entities and partnerships to advance equity in our communities.
Thank you, Alicia. Sounds like a wonderful initiative that I'm learning just about now, getting to meet you. So I'm looking to unpack a little bit more of what you're doing. But let's get our third speaker joined in on this conversation. Jennifer, good morning and welcome. I'm wondering if you could talk to our audience a little bit about some of the work that you've been doing and the resources that you've developed to kind of help educate people about anti-Asian racism, as well as the wave of anti-Asian racism that we've seen here in the wake of COVID-19.
Sure. First of all, good morning to everyone. And before I begin, I want to acknowledge the land that I am currently occupying. And I don't just mean that I'm coming to you from Lafayette, Colorado. I mean that I'm coming to you from the traditional territories of the Cheyenne, Arapaho, and Ute nations. So this is a land acknowledgement. Some of you may be familiar with this, that various organizations and people will oftentimes give a land acknowledgement. I want to start here because while I may be focusing the bulk of my remarks on anti-Asian racism in the midst of this global pandemic, anti-Asian racism shares, along with Indigenous people, along with Black Americans, being oppressed and being subject to white supremacy and systemic racism in the United States. And so I think it's also important for us to think about this coalitionally, that in other words, while I, as a self-identified Asian American who also studies Asian Americans, may be feeling this acutely, it doesn't matter whether you identify as Asian American. It matters that you identify as a human being and care about human rights, because social justice and racial justice are absolutely human rights issues, which is one of the reasons I developed as an educator the PowerPoint slide deck that I'm about to share out to you. Now, what happened was in January, when news of the virus was first coming out, friends of mine on Facebook who are also Asian American academics knew that there was going to be a rise in anti-Asian racism that would hit the US and probably the globe. And so we started to develop resources to address the racism we knew was coming, because this is what happens in the United States, that when there is a threat to the US coming from an outside nation, particularly an Asian nation, the reaction is to scapegoat anyone that you think comes from that nation. So we saw this after 9/11 with the way that various South Asian and Sikh and Hindu people were being attacked and misidentified, along with Muslim, Arab Americans, people from the Middle East, blamed for 9/11. And so we are seeing this now with COVID-19, where anyone who's perceived to be Chinese, whether they are in fact Chinese like myself, or Chinese American, Asian American, Japanese American, etc., are being subject to physical attacks, harassment, verbal abuse. And I can share some personal stories in the Q&A if anyone's interested. So this is why I developed this PowerPoint slide deck that I'm going to share out with you. The University of Colorado Boulder also turned it into a website. So I think that link is going to be put in the chat. And I believe that the slide deck will also be shared to people who signed up for this particular webinar. But if you go to my Twitter feed, I'm at Dr. Jen Ho, there's actually a Google link and the pinned tweet that you can fill out, and I will email you out a copy of this slide deck that I actually just updated in light of the global and national anti-Black racism protests. Because again, are connections in terms of anti-Asian racism and anti-Black racism emerging out of COVID-19. So just really briefly, and I'm not going to go through, don't worry, I'm not going to go through the slide deck point by point, but I just want to highlight especially why the phrase Chinese virus is racist, because that's what, okay, so for some reason it's not letting me share. Okay, I don't know if I can share out my PowerPoint slide deck with you for some reason.
Do you have share screen at the bottom? If not, I can okay, and it's not letting you.
It's not letting me, which is weird because we practiced this. It's okay.
I have it, so why don't I open it up for you?
Oh, thank you, Kristen.
Yeah, just give me, I'm gonna be slightly slower than you.
Yeah, no, I'll just talk while you're looking. So I developed this because in early April, I kept hearing people use the phrase Chinese virus. And by people, I mean, I kept hearing, and I am going to be political for a moment because I think that we don't have time in this health crisis to be subtle, right, about what's going on. So what I was hearing coming out of the mouths of many Republican legislatures, including this White House administration, is referring to COVID-19 as the Chinese virus. And as we've heard most recently from the president himself, Kung flu. I don't think I need to tell anybody why the phrase Kung flu is racist. I think that is abundantly clear. But I think there has been some confusion, especially earlier, why we couldn't say Chinese virus. If the virus in fact originated in Wuhan, China, and everything that I've read suggests that it did, why not just say this is the Chinese virus because it originated in Wuhan? So I wanted to create this slide deck in part to answer that question, to take that question at face value and to think generously that people may not understand the rhetorical harm that comes by continuously linking disease to people who are Chinese or from Asia, because there's a much longer history of doing this than our current pandemic suggests. So Kristen, if you can go actually into the place where I start talking. So this slide deck talks about, I define racism. I specifically talk about the history of anti-Asian racism. If Kristen wants to keep going through the slide deck. I give specific examples about 9/11, which I just referenced. And then I have two slides that talk specifically about why the phrase Chinese virus is a racist phrase, right? Why you shouldn't say the phrase Chinese virus. So we'll just wait until Kristen gets to those slides. And by the way, in the slide deck itself, if you notice that there's some blue underlining, these are hyperlinks. So I have broken, as an educator, I've broken all the good rules of PowerPoint slide deck creation with this slide deck. It's very bare bones. There's way too many words. But I wanted to do this as an educational tool and for people to be able to use this as their own, right? To take this basic information and put it into their own PowerPoint slide decks or share it out with whatever organization they are a member of. So let's start with this. The World Health Organization has given this virus a name, COVID-19. This is the name that we should use. So if we just think about it from a basic human point of view, we want to be called the names that we choose to be called, right? There are various people who have nicknames. You want to be called by your nickname in certain contexts, right? Or you want to be called by your legal name. You don't want to be called by a name, especially one that maybe have racist connotations. So the World Health Organization did this because they knew that there was racial stigmatization that happens when they used a geographic or ethnic label with respect to disease, okay? And then in the second slide, if Kristen can turn to the second slide. Okay, so a lot of times people have been pointing to the 1918 flu pandemic and saying, well, we say Spanish flu, why can't we say Chinese virus or Chinese flu? So the argument that just because you did it once upon a time over 100 years ago means it's okay today really doesn't hold water, right? I mean, we all understand that there were lots of things we did 100 years ago that we are not going to continue to do today. So I don't think I need to go into length explaining that. But the danger in saying Chinese virus is that you are continually saying that the virus is somehow associated inherently with being Chinese. And just as my fellow panelists pointed out, the virus itself does not have an ethnic or racial target, even though there are clear health disparities in who is being harmed most. But those health disparities are because there is systemic racism that has happened and continues to happen in the United States that causes for unequal distribution of resources to people. And so for Latinx populations and African-American populations in particular, because of the centuries of racism that has happened in those two communities, and Indigenous as well, I should add, there are going to be health disparity outcomes. And again, I will leave it to my fellow panelists who can speak much more cogently about the public health issues. The only other slide I'd like to point to, and then I'll end my time. So Kristen, if you can go to the new slide that I created. So I talk about instances of anti-Asian harassment. This is a statement my organization put out. I added 2 new slides about anti-Black racism and Black Lives Matter because I want to really talk about these, again, these connections to anti-Asian racism. And the next slide talks about anti-Black racism and anti-Asian racism. And then Kristen, if you can go to the one where we talk about being an ally. So this is a solidarity statement my organization came up with. Okay, so I saw on chat that somebody asked this question, and it's a very good question, right? What is the difference between being not racist and being anti-racist? So I think we all understand what it means to be racist, or at least most of us have a working definition, right, of what racism is and what it means to be a racist. So as a critical race scholar and as an anti-racism educator, this is the distinction I make. If you're not racist, it means that you're being a decent human being. You're not going out of your way and intentionally trying to harm people by being racist, right? You're not using racial slurs. You are not actively, consciously discriminating against people of a different race. But that's being not racist, that's being a decent human being. To be anti-racist, you actually have to act, think, speak, and have behaviors that promote anti-racism, that promote the reduction, the active reduction in harm that racism causes. Now, it may seem overwhelming and intimidating to decide that you're going to be an anti-racism educator or ally. And being an anti-racism educator or ally is not about the degrees you hold or that you're in a teaching position. It's about the will and the decision that you are going to educate yourself about the history of racism in the United States, and then you are going to act and speak as an anti-racism educator and ally. So here's the thing, the good news is that all of you can decide today that that's what you want to do. There are things that you need to do in order to become an anti-racism educator and ally, and part of that is tuning into this webinar and listening to me talk about all of these issues. The second thing would be in the PowerPoint slide deck, go through the hyperlinks, right? Start to educate yourself. I have a list of further readings, which is the last slide in the PowerPoint slide deck. Read 1 or more of those books. And once you start to learn the history of race and racism in the United States, and you are a decent and good human being, as I would imagine everyone listening is, you're going to want to become an anti-racist ally and educator, because this is about the inequities that we are seeing that people are suffering under. And I think I would say all of us, I would imagine, want to help end suffering. And so that's the last thing I'll say, and I'm happy to talk more during the Q&A. Thank you.
Thank you, Jennifer. Yes, and for those of you who are paying attention, we are sharing those slides in the chat. They will be in our follow-up email. I have not even dug into half of those resources that she said, because there's plenty of reading material for those of us who like to listen, learn, educate ourselves, so we can then think about how do we act and speak up. So I want to actually just take a moment and allow our other 2 guests, if they have interest, and that question about, you know, not a racist versus anti-racist, which is what we pulled on at the beginning. And so I appreciate Jennifer for giving us that definition. I'm curious, Mike, do you or Alicia have thoughts on what does that look like to you in your communities? And we're just going to jump right into there. And then we're going to shift back into some of those bigger questions about public health too. But I want to address that since it is front and center. Mike, do you want to start for us, please?
Our primary interest at our organization is helping Latinos come together to take collective action to fight racism. I mean, we could wait a long time for everybody else to decide that they want to be anti-racist, but I think within our own communities, we really have to do what we can to increase our economic opportunities, increase our political influence, begin to dig into some of the public policies and laws that work against us and tend to support racist outcomes. Our view has always been as an organization that it's, nobody's going to do it for us. We're going to have to do it ourselves. And so we are very much about community organizing. We are very much about training people to be advocates. And we're very much about introducing college students, parents of children who attend under-resourced public schools, neighborhood volunteers who are concerned about social determinants of health in their neighborhoods. We work with folks who like to bring people together to work on these things collectively. And basically, we're fighting back.
And I'll just jump right in. I totally agree. Our Be Well Health and Wellness Initiative focuses a lot on race, but we focus a lot on how we, and anti-racism, we try to engage partners in understanding why it's important to not just be racist, but to also be an anti-racist. And so what we have done is provided opportunities for people to learn that, but at the same time and in parallel, creating systems and working within systems to infiltrate those systems with folks that are on the ground and understanding how these policies and practices that have been put in place intentionally to advance racism have impacted our communities in ways to dismantle those systems. And so our primary goal is really looking at what are these systems and how do we infiltrate these spaces to ensure that the voice of the community and those being most impacted on the ground are involved. We build the capacity of residents to be able to advocate on their own behalf and also to understand how these policies and systems work, how we can work with allies and how people can be a true ally with us to kind of look at those upstream issues that are really impacting residents in their day-to-day lives. I agree with my fellow panelists if we continue to wait for others to change these systems for us, we see where that has put us in the past. And it's also important, as one of the fellow panelists said, to look at history and to think about what changed in history to get us to this place, or what things were implemented in history to get us to this place, and how those policies and systems have continued to be perpetuated in some of the things that we're doing right now. And so thinking about even redlining and how that has pushed communities out in terms of housing, et cetera. So what are things that are related to that now, and how is gentrification taking place right now? It stems back to a lot of the policies that were put in place before. So why has COVID hit these communities so hard? Because they have been exacerbated by things that have already existed. And so, yes, the African American, Latino, and other communities of color have been impacted significantly, but we have to think about history and how that has advanced this, and then think about, okay, why are we here and what do we do? We can't just sit idly by and say, we're going to have continued conversations. We have to really get on the ground and take action. And that's what Be Well is about, and partnering with various communities to do that. And it's not driven by ourselves, right? It's not driven by leadership. It's driven by people on the ground who have told us that we're tired of being the ones most impacted by everything, because it's not just COVID that has impacted our communities. It has been chronic illness and disease that has impacted our communities. It has been low-income wages and not being able to excel in various areas that have impacted our communities. So really thinking about what are strategies to address that, and that's what we do in Be Well and have been successful in advancing policy, et cetera, to do so.
Thank you both. Let's build on that just a little bit. So Alicia was talking about the exacerbation, right? And some of that comes from these historic and systemic inequities that have been built into communities of color, racial, and ethnic communities. We've talked a little bit about the social determinants of health and how that all comes into play. What are some of those underlying challenges that communities that you're familiar with or have worked with have that you think have been exacerbated because of the COVID-19 crisis? How about I start with Dr. Ho. Jennifer, do you want to take a little stab at that? And then we'll turn that back over to Mike, because I know Alicia just gave us a really good overview of some communities she works with.
Well, I think, you know, specifically in terms of the Asian American populations, and by the way, it's also really always difficult to talk in broad strokes about any racial group, but I'm going to, you know, what I will say is this: if anyone is perceived to be Chinese, so that means generally anyone of East Asian heritage, Southeast Asian heritage, they're having an additional level of stress put on them. This is why I think that racism is a public health issue. And so, they're also, quite frankly, like, and I think about this myself, when I leave the house, am I going to have to be confronted by someone who's going to attack me verbally or perhaps physically? Because I know that there have been people who have been stabbed, had acid thrown in their face, been punched in the face, been kicked, been, you know, someone tried to throw someone on the subway platform, right, in front of a train. So there's real violence happening against people who are perceived to be Chinese and Asian in the United States. And that's also going to cause an emotional and psychological toll. Now, I will also say this is relatively new for some people, for some Asian Americans, right? It's relatively new for some Asian Americans to be faced with this level of violence and harassment. And so one of the things I'm also seeing are the ways that Asian American organizations are really coming together and thinking through how to address this racism. And I'd say in a good way, also thinking about working in coalition with Black Americans, right? Really kind of thinking through the common root of white supremacy that is causing anti-Asian racism and has caused anti-Black racism in the United States.
I really appreciate the other folks who have mentioned history, because I think those of us who study public policy tend to fail to appreciate the importance of history and how that's shaped the institutional environment that we all live in ways that, you know, we're not used to thinking critically about, because it really helps to have a historical perspective. We in Colorado, as Latinos, are affected by the fact that in 1846, the United States government, which was more back east in those days, decided to invade Mexico and declare war on it. It was basically an unprovoked war that, and it was a war of aggression by what was then the United States that was seeking more land. And when the war ended in 1848, as some of us want to say, the Latinos who lived here didn't cross the border crossed them. We inherited a place in a society ruled by another government with different legal traditions. The results were that people who made a living in farming and ranching were displaced from their land. The treaties that were signed to end the war were violated by the government of the nation that did the invading. We ended up with a workforce that was displaced from their way of supporting themselves, and were encouraged to become migrants and to work in new industries, railroads, mining, and working for other agricultural employers. And those patterns, it may seem like a long time ago, but those are still dominant patterns in the workforce today. I focus on the workforce because I think a lot of what we see today can be explained in economic terms about who is employed where. This idea of labor market segmentation. Someone suggested a moment ago that, well, gee, labor market segmentation, that sounds like institutionalized racism, right? And I'm not going to argue with you. We've had a race-conscious labor market going all the way back to colonial days. Our race defined who got paid and who didn't back in colonial days and in the early days before the Civil War, when most of the gross domestic product of the country was produced by slave labor. That's the African-American history for the most part in this country. We've had a very race-conscious labor market, and those things don't evaporate because someone comes in with a wonderful new federal program like the War on Poverty and all of a sudden it's gone. These things persist, and it's living in the middle of it is sometimes hard for us to see it. But history helps us think critically about what's going on around us today.
Absolutely. Thank you, Mike. Alicia, please go ahead. Yeah.
And you know, I think the panelists have covered most of it. The only other thing that I'll say in terms of how COVID-19 has specifically exacerbated some of the inequities or the social disparities that already existed in our communities. When you think of communities of color, a lot of our communities of color were often plagued with higher instances of chronic illness and disease. We're often plagued with lower income wages in some areas, or at least thought to have lower income wages in certain areas. We're often plagued with things like education and not having the best education systems, and we know that to exist. And those are for a variety of other reasons as well. So when I think of layering COVID-19 on top of that, and then saying that our schools have to go online and provide education for their children online. We have many of our workers who are the frontline workers that are battling this every day. We have many of our families who may already have low incomes. We have many of our families that are maybe suffering from some type of chronic illness, because we forget that there were things that actually occurred in our neighborhoods that helped to advance those illnesses. And then we lay COVID-19 on top of that. So then our communities are losing their job at a faster rate when it comes to economics. We are not able to educate our children because we may or may not have the resources to be able to do so in our homes. And then we have this overall COVID-19 experience that we all have to deal with in addition to the microaggressions that we face just day to day, being who we are, just being who I am in society as an educated Black woman. And I feel like I have to acknowledge that I have significant privilege as well, right? Being on this platform with you is a privilege. To be able to even express this is a huge privilege. So being a Black woman and acknowledging that I have privilege, and then looking at my fellow counterparts who do not even have the same privileges that I have, just those microaggressions that they have to face every day and that I have to face every day. Those are things that have been exacerbated during the COVID-19 pandemic. And so thinking about what are ways that we can address those issues and those challenges, one, by being able to have a voice and providing people with a voice and opportunity to express that. But then two, in advocating for these systems to be able to change on an ongoing basis. And I have specific resources and opportunities and ways for people to engage in that I'll share later, but really understanding those systems and how we migrate those systems and make those systems more equitable for the population as a whole, rather than just the status quo.
Let's build on that too. Alicia, you're leading us into some good discussion, specifically dismantling systems, right? We've all touched a little bit on it, but what are specific ways that you're doing that? And maybe what are some ways that folks tuning in can think about how do they actively participate to help dismantle systems of racism? Jennifer, do you want to start with us? I see a head nod, and then let's circle back around. Let's just do a little loop-de-loop, Mike, and then we'll end up with Alicia too, who brought that question to our attention.
Yeah, so one of the things I've been saying, and by the way, I've been doing several, so one of the things I've been doing to dismantle systemic racism is to talk about it. And I'm so grateful to have this platform to talk about it. I've been doing several webinars since I developed the PowerPoint slide deck. And what's really important is for everyone who's watching this, if you have a desire to be anti-racist, that's the starting place, right? Being anti-racist is not about an ethnicity. It's not an identity. So just because I'm Asian American does not mean I am inherently more anti-racist than Kristen, who optically I would identify as white. I don't know how you identify Kristen, but optically, you know. So if you want to be an anti-racist, that's great. There are tools for you to be an anti-racist and help dismantle systemic racism. So again, the first thing you've got to do, and it's like anything else that you are doing for the first time, you have to practice and you have to exercise. So being an anti-racist means this is a muscle that you have to develop. And like with every muscle, it's going to hurt. You are going to make mistakes. It is going to be uncomfortable. You have to live with that sense of working this anti-racism muscle and being uncomfortable and potentially making other people uncomfortable. But it is definitely worth it if what we have as the end goal is a more just society, right? That's what I want. I want a more just society. And by the way, I know I'm focusing a lot on race, but I believe in intersectionality, which means I believe in a theory of overlapping oppressions, which is, I believe that if we are going to dismantle systemic racism, along with that are poverty and sexism and homophobia and a whole bunch of isms. And I know that sounds overwhelming, right? Because I'm talking about a whole host of social ills. And it seems like, how can we end racism, let alone end sexism? And all I'm trying to say is a lot of these things are intertwined, that when you start untangling and really seeing this as a human rights issue, you will see that it's necessary also to think about the value of all human beings for who they are. But read and then talk. That's what I would say, read and talk.
I would not argue that there's only one right way to be an anti-racist. I think it's a question of what can each of us do within our own abilities and opportunities. Awareness makes it possible to do something. And so listening to others and becoming more aware of how pervasive racism is and how it affects everyday living people, I think is a really important first step. You can do it by reading, you can talk, but you can do it by talking to people that you haven't really talked to about this before. There's lots of different ways to learn, but awareness is one thing. And then what are the opportunities? What can you do? You know, I'm 74 years old. Doctors tell me that I shouldn't be going to mass demonstrations. So I don't go to quite as many as I used to, but there's other things that I can do. If I think back when our organization was started in 1964, the city government did not employ Latinos. Most employers did not employ Latinos for most jobs. Latinos were not allowed to live in most neighborhoods. We were actively discouraged from voting. We were not selected to sit on juries. That's the way it was in 1964. So we did what we could. And that was about community organizing and basically making things uncomfortable for other people that, until they reconsidered whether to let us in. And sure enough, the next mayor of Denver appointed the first Latino to a mayor's cabinet. That never happened before. And that person had the opportunity, because he had the legitimacy being within city government, to start our organization. And it was a fellow named Bernie Valdez. and native to the United States, not an immigrant, but had grown up. He learned English during the Roosevelt administration when he got his first job in government. But you know, he was able to do what he could, and one of them was starting a community-based organization. Today is a different story. We have other opportunities. We have begun electing people to the state legislature. I take some of the college students that participate in our program, and we place them with individual legislators within the state capitol, and they work on changing laws. We couldn't do that back in 1964. And changing laws is a lot of what needs to happen to help dismantle some of the legal frameworks that historically have always supported racism and still do today. So you do what you can with what you got. I think the awareness and the commitment to do something, whatever it is within your power to do, is the most important ingredient.
Thank you again to the panelists. I would just add that one of the things that I feel like we can do is to, one, as everyone has said, educate ourselves. I think it's important that we educate ourselves and understand the history and the context of what we're operating within, and also understanding our privilege. But then it's also in using the privilege that we have to be able to advocate on behalf of others, and to not be fearful of doing that. And I know that this is a very challenging topic and people have various different views, but it comes right back down to right from wrong, and knowing and understanding that everybody is human and that we all deserve access and opportunity to certain things, and we want that for our family. So what you would want for your family, I too want that for mine. And so thinking about how we can step outside of ourselves and think about, how can I use my privilege is what I've done. How can I use the privilege that I've had and that I've been granted, even as a Black woman, still functioning within a racist context or a racist society? How can I use the privilege that I have to be able to operate on behalf of others and advocate on behalf of others, to be able to look and say, or to use a more critical lens and saying, how is this system impacting me? How is this decision impacting my fellow human being here that wants the same thing that I want for her family, that they want, that I want for mine? So how can I utilize the privilege that I have to really help to advance strategies that uplift the whole, instead of just seeing how it uplifts me? And that takes a lot of courage, but it also takes education and understanding why things are the way that they are right now. I mean, we're in a 1 hour panel right now and just trying to break down and talk about this in a discussion, but think about the years and the history that has built this, that our country has been built on in terms of racism and how it's impacting us. And so the one thing that I would add to all of this is really utilizing our privilege and stepping out to really think about, you know, what are ways in which I can use the benefits that I have to benefit someone else when I see these things happening? Because we see them every day. We see when people are being treated poorly or unfairly in a way that we know it's about race. We saw when George Floyd's neck was pinned down. We see this every day. That was an extreme measure, but we see things happening every day. And how can I use my privilege to say, no, this is not right, and I have to step out and be that voice? And that's what we're not only doing for our allies, but inside of our communities as well, because you get so fearful and then you don't know how and what to do or to say. And so thinking about the best ways to do that, to use the privilege that we have.
Thank you. We could carry on this conversation indefinitely because there's so much to talk about. I am so thankful for all three of you. I am so grateful to have gotten to meet you and work with you, albeit remotely, and for your perspectives and wisdom today. Hopefully it was very powerful for me, and I hope our audience enjoyed it as well. So thank you so much for your time, for all the work that you all are doing to work on anti-racism efforts. I'm going to go ahead and wrap us up today. We're coming up on our hour. Thank you everyone who tuned in. And I want to just give a quick plug for some of our future work. We appreciate those of you who have been tuning in since we started this series back in April. We also appreciate your perspectives and filling out our survey so we can think about how to frame topics in the future. We've got a lot of interesting episodes of how we think about COVID. I think racism and race is and inequalities is going to continue to play out in so many things that we have. We're also going to talk about mental health in the future. We're going to get into some of the science topics as well too, and talk about zoonoses and the transfer of viruses from animals to humans, economics, lots of other things here in the future lineup. So thank you for tuning in. Stay tuned for the future episodes. As a reminder, follow us on Twitter to just stay up to date on when announcements come out. You can follow the Institute at Institute Cy Paul. Our museum is at Denver Museum NS, and our colleague at the School of Public Health is at Colorado SPH. Our speakers, we will send you out a huge list of resources and reading materials, including Jennifer's presentation. Alicia has a plug too for a workshop she's putting together, and I didn't get her a chance to talk about it. I apologize. She's gonna share that right now while I'm closing up my remarks. This is a dismantling racism systems. Anything you want to say about that real quick, Alicia, before we?
Yeah, just quickly, this is a specific resource that we have, and we can send this out as well. We're doing a training that we do with our communities as well as with those that are interested in understanding more about how to dismantle racist systems. And these are the topics that we will be addressing over the next several weeks. Please do feel free to join us on those and to register at the link above. And I think that Kristen has that to be able to share in the chat as well.
Absolutely. Thank you, Alicia, for the plug. So keep your eyes out for our follow-up email with all these resources and information. I encourage you, as many of our guests pointed out, that if you have the power and you have the privilege, of course, our first step is to recognize that, to listen, to educate ourselves, to think about racism, to think very critically, and then engage in the conversations and then do the work. So I'm very appreciative for all of our guests, for all of you tuning in today. Thank you. We'll see you back here next Monday at 8:30. I hope you have a good rest of your Monday.